MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Hey, welcome to the MedBix Webcast. This is Ramana Annamaraju. I'm the host. No, I'm not Albert Einstein. Maybe my guest is. He has a Harvard education. Yeah, he did a residency in the Harvard hospital close to the Boston, and then he is a professor of radiology and radiation oncology. It's a very rare combination. You don't see it nowadays. Used to be like that before. Now he is a professor of radiology and radiation oncology. He does both. So that's a very helpful because you can see both point of views in the cancer point of view and the radiology point of view. You can understand that, because radiology is growing. That's the only way you can see inside the body without cutting or without any invasive surgeries, right? So that is the one way. Second thing is now we are the baby boom generation. We are getting older, so cancer is coming, is growing. Number of cases are growing in the cancer patients. So this is a big worldwide phenomena. So there is a lot of changes going on. I used to own an imaging center in Atlanta, Georgia. I used to provide ultrasound for particularly South Side people with backgrounds with economic backgrounds are not there. There's not much access there. And then I used to go to rural Georgia, provide a mobile ultrasound. It's a huge van. And then I have a lifting, the lift up. I used to have a lifting mechanism there. A lift, we have to go through the lift. It's like the ultrasound is a refrigerator size. Now you can do. There is a few blocks away from here. There's a new company called Exo Imaging. It is just they work in a iPhone, and then just a small probe goes there, and then you don't need any other technology. It is just as good as those I was working at those days. So it's really amazing. In say the technology, the software, and the processes went on a really rapid speed in radiology. Let me bring Dr. Suresh Mukherji. He's joining from Indianapolis. He is a professor of radiology and radiation oncology. Dr. Mukherji, welcome to the MedBix Webcast.
Hey, Ramana, how are you?
Thank you, sir. Okay? Thank you for coming in. So tell us a little bit background of yours. You have two hats you wear as a professor, radiology and radiation oncology. Tell us a little bit about your background, how you ended up in both sides of the coin.
Well, thanks again. Thanks for having me. I think this is my third or fourth time on MedBrooks, and congratulations to you for what you've started. It's a really unique format, and you've been doing it for many years right now. So it's it's wonderful, and I think your podcast and your video cast just continue to get better and better. So congratulations to all you've done and all you'll continue to do, and try to, as you eloquently put it last time, really focus on polymath, which are areas where you want to be domain expertise in more than one area, and a lot of people really don't want to focus on that. So I think it's great what you're doing and what you've accomplished. So thanks again for having me.
Thank you, sir. So, just thank you for the compliment coming from you particularly. So let me ask you your background. I said that how did you end up in the radiology and radiation oncology? You're doing both sides of the coin. Just give us a background of that. You don't see too many people on both sides, So how did you end up there?
Well, my background is diagnostic radiology, and for me, my interest has always been in neuroradiology, but really head neck radiology, which sort of goes from basically the base of the skull down to the clavicles. And as a radiologist, we look at all sorts of really fun imaging studies. So we look at CAT scans, we look at MRI scans, sometimes we look at PET scans. So when someone asks me what I do for a living, I just say, I get to play Where's Waldo every day with multi-million-dollar pieces of equipment. And oftentimes, what we're trying to diagnose is cancer, is head and neck cancer. And so, because of that, and my interest in head and neck cancer, a lot of the head and neck cancers over the last 20 years or so are actually treated with radiation therapy. And in order to properly identify where the tumors are located, and then also identify the sites where the tumors often metastasize, you have to have a thorough understanding of the anatomy. So not only do you have to understand the anatomy, but where can these tumors spread? And with the evolution of different types of radiation therapy, when radiation therapies actually target the anatomy and they try to optimize the dose that they give, they have to have an understanding of the anatomy. So that's why there's always been a natural fit for me between radiology and radiation oncology, because what we do determines a treatment, but by the same token, radiation oncologists have to have an understanding of the anatomy. And so that's why over my career, I've often had joint appointments in radiation oncology and radiology in order to help identify the target organs and to see where the tumors have spread and potentially metastasize. So I really don't think you could have one without the other.
Dr. Mukherjee, you wrote more than 200, 400 scientific papers. You're authority in this whole area. Let us talk about a little bit about are you using when you started your career now? Is there any big differences you see in the technology and the now the I'm in Silicon Valley. Everybody talks. They misuse the AI word here. So tell us a little bit what is real value of AI or whatever the advances going on in the radiology and radiation oncology.
Yeah, I think I always like to joke that I was born in the last century, I trained in the last century, and so I remember what the last century was like. So we have seen dramatic changes in the technology that's available. So when I started my residency, predominantly we were just doing mostly CT scans, but over the last 30 years or so, now we're seeing more imaging with MRI scans, certainly. Um, Over the last 15 years to 20 years, we're able to image the body based on glucose metabolism, which is the basis of PET scanning. And now we actually have the ability to um, have more ways to target specific tissue types. And so now we're getting into the area of molecular imaging, and now we can actually treat patients not only with radiation therapy equipment, but by specifically targeting tumor specific cells and attaching a small amount of radiation to those cells that are specifically targeted to specific tumors. So I really think that's a very exciting area to be in right now, not only from a diagnostic standpoint, but from a treatment standpoint. So that's sort of what we refer to as the magic bullet. We've been looking for the magic bullet for years, where you have a specific tumor type, it expresses a certain signature. And if we know what that signature is, that it's attached to those tumor cells, then we can create a way to find it, to attach to it, and then potentially kill it.
What is the AI role, artificial intelligence role here? Is really, do you have seen any artificial intelligence tools that you're using now? What are the real benefits from the last couple of years ago to now? Do you see any AI advances in that sense, Dr. Mukherjee?
Yeah. I mean, I use AI in my daily practice.
Mhm.
So, but what I can show, if I can just show this slide, let's see here. Hopefully you can just give me 1 second. It's just loading, I believe.
But it's a little bit harder to show the sharing it. You can talk about
Oh, you
that.
can't do it. Let me see. Let
I
me
have
try.
to share it, and it's a little bit. You have to share the screen, and it's a little bit complicated.
Yeah, can you see? Can you see that, or can you see what I just shared, or not?
Show on stream. Yeah, I'm just asking you. Do the yeah. Let me see.
Does it say
See.
strategic deployment in radiology departments, or can you
Yeah,
see that? Or
I can bring it. Yeah,
do you see
yeah,
that?
yes.
So
Strategic. Yeah, deployment and radiology and department. Yeah.
yeah. So here's, people often talk about artificial intelligence in radiology. Um, And as you know, artificial intelligence can be used in any field that you're in. So whether you're in some type of technology, whether, for instance, my daughter's a software engineer, that you could potentially get artificial intelligence to write code for you. In the finance world, you can use artificial intelligence to potentially help predict market trends. But when we talk about medicine, when we as a radiologist in general think about artificial intelligence, what we're trying to figure out is, can artificial intelligence be able to help us detect an abnormality? So when we are in our day-to-day practice, when we are looking for Waldo, I used that analogy earlier, when we're looking for using where's Waldo, what we're really looking at, and I think you can see my arrow on the right, this is the term that we use as diagnostic utility. Can we use an artificial intelligence algorithm to look at a chest x-ray and help us find a lung nodule? Can we use artificial intelligence on a head CT and help us identify a brain hemorrhage? Can artificial intelligence be used in that? So when we really talk about the high profile uses of artificial intelligence, it's for us as radiologists to help us do our job better and detect abnormalities. But right now, the biggest advancements in artificial intelligence in radiology has not necessarily been in our ability to detect abnormality, but a lot of it is based in these processes. So for instance, if you look at here, there's something called image acquisition. So when you have a CAT scan or an MRI scan, the first thing that the technologist does is that they put you on our table. It's probably not a comfortable table, right? It's a flat table. Um, we have a little cushion in it to try to make it as comfortable as we can for you. But then what we do is, it's like an iPhone. What we end up doing is taking different types of pictures. But what the artificial intelligence allows us to do, so for instance, if you're getting a CT scan, we want to acquire the best images that we can. But the best images that we can get really oftentimes are at very high doses. So what the artificial intelligence allows us to do is to take images, acquire those images at a lower dose. So the real value of the artificial intelligence is to have the same high quality images that we would normally obtain, but we can acquire this by using less radiation therapy.
Excellent point.
So similarly, I don't know if you've ever had an MRI scan or not, but people don't like to get in MRI scans, right? The table is uncomfortable. Then you get put in this long rectangular object with a little hole hollow in the middle, and then you're there for anywhere from 15 to 45 minutes, and it's very loud, right? So
Claustrophobia.
yeah, so it's hard. I mean, it's hard as a human to get put in a setting like this, in a very uncomfortable environment, and it's very noisy. But you have to stay as still as possible, because when you're getting an MRI scan, and when we do an MRI scan, essentially what we're doing is that we're taking pictures with magnets. So we're turning on and off the magnet, and that's how we generate our images. But if you move as our images are being acquired in an MRI scan, that movement degrades the eventual images that are created. So what the artificial intelligence allows us to do, again, similar to the CT scan, is that it facilitates and accelerates the ability to obtain the images that we get. So for instance, sometimes it'll take 3 minutes to get an image of your brain. Some artificial intelligence programs can now allow this to be done, and I think I have an example in the next slide, in half the amount of time. So for instance, this image on the left is a brain. I think you can see the ventricles and you can see the sulci. And this took 1 minute, 39 seconds to obtain. And this is the exact same patient, the exact same type of way that we acquire these images, but we use an artificial intelligence program. And you can see there was a 56% reduction in the amount of time it took to get those same images. Similar, this was actually a PET CT. It took 12 minutes here, and then using this artificial intelligence approach, it actually took only 3 minutes. So if we go back and we look at really all the uses in artificial intelligence, we're seeing the biggest benefits right now in ways that we actually acquire the images and ways that make me more efficient as a radiologist. So, for instance, if I see your head CT and I have to dictate my findings about your head CT, then I have to come to a conclusion. So I have to basically repeat exactly what I said in the findings in the conclusion. There are now artificial intelligence programs where I just click a button, it reads what I wrote in the findings, and it auto generates a conclusion. So I don't have to say any more. And I know that's made me more efficient by 20 or 30% because I didn't realize how much time it was taking for me to actually reread what I've already dictated, think about what I want to say, and then redictate that. So again, this is another type of artificial intelligence that's actually helping our processes. But I mentioned before, the highest profile areas, the one that garners everyone's attention, is the ability to detect abnormalities. But right now, we're seeing a lot of enthusiasm really in the processes that's making us more efficient radiologists, which improves the access that we give you.
Someone articulated it so well, you articulated so well the benefits of that once one in the CT scan side, reducing the dosage, and the MRI side, movement itself, the artificial intelligence can help, and then your efficiency increases 20-30%. It's the first time I heard a very clear terms what the benefits of AI in radiology. Thank you so much. That is really wonderful to hear that, say. So let me, and another idea I wanted to ask you, you are also director of the advisor to Santiniketan. He is Rabindranath Tagore Nobel Prize winner in India. He started this historical institution in India. Let me ask you the questions in, I was involved in a imaging group one time, all the radiologist groups, and when I had an imaging center. One day, Laura Bush University, Laura Bush Hospital in Afghanistan needed a radiologist. So through my group, I connected somebody in Quetta in near Pakistan, and I sent him there without even I don't know both places very well. I sent him because of my connection, that the internet connection at the time, beginning of 90s, that I did that. So is that artificial intelligence will be helpful in the future, you think, for the places like Africa, India, or Afghanistan, where there are not too many radiologists there? Do you think you see a benefit there, Dr. Mukherjee?
Yeah, I think I mean you said a lot and you mentioned a lot of scenarios. So I think the first point that I want to make is, in fact, tomorrow, because radiology is basically digital information, they're all basically zeros and ones. I'll be for the last 2 years or so, I've been helping the radiologists in Tanzania interpret studies that are performed in Tanzania. So, and I've done this for different countries as well too. It's just sort of my way to kind of give back, if you will, to society. I'm not smart enough to develop an iPhone, but what I hope to do is just make a difference in the world one day at a time, one person at a time. So we have these readouts with Tanzania where they'll show me 5 or 6 cases. We'll go over the imaging studies and I'll go over their reports and then educate them, the fellows, which will hopefully cascade to better patient care. But that's something that's not necessarily artificially really dealing with artificial intelligence. I think where it does help in artificial intelligence is that if you are in an area where there's just not enough radiologists. So right now in the United States, there are not enough physicians in the United States, there are not enough physicians globally, and there's certainly not enough radiologists. But what the hope is and the promise is that if you can take a chest x-ray and you put it through an artificial intelligence program, and you want to say, is it abnormal or normal? The artificial intelligence programs in general can be adjusted such that the normal x-rays don't necessarily need further interpretation, but anything that's abnormal can then be sent to an actual person to be interpreted. So I think in the future, artificial intelligence is going to be used to help population health and actually global health by providing screening, a method of screening, such that those studies that are abnormal can then be sent to areas with subspecialists that can then look at those. And the ones that are normal can probably be interpreted by the program, and that really is all based on how you adjust the algorithm. Where do you want your ROC curve to be? And that's a fairly simple adjustment that you can make.
Saving life is better than an iPhone talking, Dr. Mukherjee. You are saving lives. That's more valuable to all of us, the humanity itself. Thank you. For doing the great service to the Africa that you're talking about is really impressive. Um, Let me, I am, I'm from Silicon Valley. So I'm going to show you here is everywhere sensors. Morning to evening, they talk about sensors. I'm going to talk about a new sensors may be coming in the future. It is related to Calcutta a little bit. I'm going to show you that presentation. And then after that, I come back and talk with you a little bit more about it and see your opinion on this one. This is called Dr. Suresh Mukherjee. He is a professor of radiology and radiation oncology. And then we're going to present a topic on Bose-Einstein condensate. I'm going to talk about that. Let me tell you what that is. I'm going to bring both of us in the side. You can, Dr. Mukherjee can come in anytime on in the make a comment. So this is a Bose-Einstein condensate. Bose, actually, I'm going to tell you why Bose name came. They come there. Cell is a cell whisperer. It is basically a whisperer of the cell. It tells you any abnormal things in the cell. There's a sensors. So I wanted the story in Calcutta, Calcutta's the city of joy. I don't know whether Dr. Mukherjee is born in Calcutta or not, but he has connected with the Calcutta. Calcutta now is called Kolkata. Is a city of joy. His name is the Dominic Lapierre. Is a filmmaker from France, and he produced a movie called City of Joy. In that movie, it's actually based on a real events. There is a guy called Gordon Dayanand. Is a guy, is a nurse, and then he created a fictional story based on that to build a clinic actually in Calcutta, in the slums, in the American doctor played by Patrick Swayze, the late actor Patrick Swayze, and a priest and a rickshaw puller. They get together, build a clinic. It's a very compelling story, beautiful. I saw the movie. It's a really, really great movie. It won the Oscar also, I think. So it is the story started. That's the reason is Calcutta is a very famous place for intellectuals. Is previously capital of India. So Rabindranath Tagore was one of the famous poet. He won the Nobel Prize in the poetry. His poetry was amazing. I don't know Bengali, but I did some of the translations. I saw the translations of Rabindranath Tagore's poems in English. Oh God, but they are really must read. It is really heart touching. And then another one is Jagdish Chandra Bose. He's one of the father of semiconductors. In fact, he did a Wi-Fi and semiconductors. He did a lot of plant chemistry. He is a very pioneer in a lot of Wi-Fi systems. So his name is mentioned all the times when Wi-Fi comes in the history. Then Swami Vivekananda is from Calcutta. He is also a prolific, he's a spiritual leader of India. He gave a very compelling and very thrilling messages in Chicago in the World Religion Conference. He was became a popular after that, Swami Vivekananda. The last and the most important person that I'm going to talk about is a Sachindranath Bose. He's a physics professor. He was born in, I will tell you a little bit about him. That is where I want to talk with him a little bit about it. He's a mathematician and physicist. He was born in 1894 in Calcutta, India. He was born to a railway employee, His father is a railway. He's the only brother among 7 sisters. Think about that, guys. He survived. So he was studying physics. He got a bachelor's degree in physics, University of Calcutta, or somewhere Dhaka, around that area. Then he wrote a letter to. He was playing with the mathematics, and he flipped a coin. Is like a coin. He assumed the coin has a both head and tail instead of head and tail. What he assumed was the coin has both heads, and then see how the mathematics turned out to be. So it turned out to be very strange. Mathematics came out. That is called. He wrote a letter to Einstein and said that, sir, I did something interesting. Would you like to do what he suggested is very interesting. Let me tell you what he did. He was saying that in particular situations, a particular bunch of atoms in a particular scenario, they act like a one big atom. Or you take billions of atoms together, and then in a microscopic, in a certain situations, they act like a one single big atom. I will explain what that means, why it is important. This is important because, if you wanted to study aliens, for example, if alien planets are studying about humans, how can they, if they have a telescope, how can they read about it? How can they? We are now trying to understand the atmosphere on the exoplanets. How do you do that? The telescope, one way to find out is the actions. They may not know individual humans, how they look like, but if you put a telescope during the ball games, they do Mexican wave. You see that all the people do Mexican wave. Then they can see that a big one on the telescope possibly, and they can deduct from that one, hey, these humans have hands. So is an indirect deduction. You can do that telescope by watching, observing. Similar thing is that what Bose is suggesting. What he was saying is, we don't know the secret life of our particles. Particles are here and there same time. How could it be possible? So we don't understand how could be a particle in 2 places same time. How could a particle goes through a wall without there is nothing there? So Einstein got a problem with it, even though he was the origins of that quantum physics. He had a problem with this kind of a cuckoo stuff. He thought, quantum physics is why a particle to be in 2 places same time. He was now he didn't like it, so the Bose came to his rescue. Bose sent this paper. He says that observing, if you blow up, if you act these bunch of atoms, you cannot watch what these individual atoms are doing. But if you bunch of them put together in certain situations, they act like a one big atom. You can catch them in action. How they could be in 2 places same time. Microscopic action in a macroscopic phenomena. You can catch in the action in the macroscopic world. That was what mathematics he suggested. Bose suggested that kind of a very ingenious theory he suggested to the Bose-Einstein that catch them in action. Einstein loved it. He added something to it. He added photons, and he did a little bit more mathematics, and he gave the paper to the German. He published a paper. It's called Bose-Einstein Statistics is called. He published a paper with his name, Bose, and his name he put together, and Bose-Einstein Statistics, a new branch of mathematics was born. I'm going to show a video a little bit about it. I'll tell you what this Bose-Einstein statistics here.
In the 1920s, quantum theory was emerging as the best hope of understanding these strange phenomena. Its central idea was that atoms do not always behave like individual particles. Sometimes they merge together and behave like waves. They can also be particles and waves at the same time. Even for great minds like Albert Einstein, this strange paradox was hard to accept. In 1925, a young Indian physicist, Satyendra Bose, sent Einstein a paper he'd been unable to publish. Bose had attempted to apply the mathematics of how light particles behave to whole atoms. Einstein realized the importance of this concept and did some further calculations. He predicted that on reaching extremely low temperatures, just a hair above absolute zero, it might be possible to produce a new state of matter that followed quantum rules. It would not be a solid or liquid or gas. It was given a name almost as strange as its properties: a Bose-Einstein condensate. For the next 70 years, people could only dream about making such a condensate, which has never been seen in nature.
Matter can exist in various states. Atoms at high temperature always form gases. If you cool the gas, it becomes a liquid. If you cool the liquid, it becomes a solid. But under certain circumstances, if you cool atoms far enough to extremely low temperatures, they undergo a very strange transformation. They undergo an identity crisis. So let me show you what I mean by an identity crisis. When you go to low temperatures, the quantum mechanical properties of the atoms become important. These are very strange, very unfamiliar to us, but in fact, each one of these atoms starts to display wave-like properties. So instead of points like that, you have little wave packets like that moving around. It's really difficult for me to explain just why that is, but that's the way it is. Now, as you go to very low temperatures, the size of these packets gets longer and longer and longer. And then suddenly, if you get them cold enough, they start overlapping. And when they overlap, the system behaves not like individual particles, but particles which have lost their identity. They all think they're everywhere. This little wave packet over here can't tell whether it's this one or that one or that one or that one or that one or that. It's there and it's there and it's there. They're all in one great big quantum state. They're all overlapping. They're all doing the same thing. And what they're doing, to a good approximation, is they're simply sitting at rest. This Bose-Einstein condensate is very difficult to imagine or to visualize. I can imagine what it's like to be an atom running around gaily, freely, bouncing into things, sometimes going fast, sometimes going slow. But on the Bose condensate, I'm everywhere at once. I've lost my identity. I don't know who I am anymore. I'm at rest, and all the other atoms around at rest, but they're not other atoms around. We're all just one great big quantum system. There's nothing else like that in physics, and certainly not in human experience. So just to think about this causes me wonder and confusion.
So that is the Bose-Einstein condensate. So is it a practical or just a theory? So a lot of people didn't know 75 years after that. So really, that was the video that he saw, 75. So Heisenberg has uncertainty principle. What is the uncertainty principle? If you're running in a car, you could, if a speed and the position, if you go fast enough, I can measure the speed, but position I cannot measure with the exact position to the exact precision. So if I know the position, I lose the speed. So one of them I always lose. I don't get both of them exactly same, the exact precision. That's what the Heisenberg uncertainty principle is, a complementarity principle. Speed and position and momentum, or the complementary. So they're so speed and momentum, or once you have that is uncertainty principle. There is uncertainty involved in say. If you know the speed, you will not know 100% about position. If you know the position very well, you don't know the speed exactly 100%. That is uncertainty principle. So, but what happens is when you take when you cool the system all the way to the absolute temperature, what happens? It becomes speed becomes zero. The molecules, the speed, actually the velocity of the molecules becomes zero. But if it becomes zero means you know the position, right? But that's a big no. Position cannot be known in the quantum physics. So no fixed position. So that's why it becomes a wave. Magically, it becomes a wave because it doesn't. The nature doesn't want to tell you where it is. So it denies that, and it becomes a wave. So it is all over the place now. So you cannot figure out the position. Now you have a problem. If you know the speed, Then speed is zero. You know that you wanted to catch that position, but you never catch it because that Heisenberg uncertainty principle spreads across the whole wave function. It becomes a wave. That is the Bose-Einstein statistics. Is the Bose-Einstein condensate. Is the fifth state of matter. You see a plasma. Then you see if you cool it, it is become a gas. If you cool it, it becomes a liquid. And then you cool it is a liquid, solid. When you cool it all the way to the absolute zero, it becomes a Bose-Einstein condensate. It's a fifth state of matter actually.
So, Ramana, do you use the Bose-Einstein condensate and the Bose-Einstein statistics interchangeably?
That is a mathematics they use actually for the Bose-Einstein condensate. All the mathematic descriptions they use Bose-Einstein statistics for the Bose-Einstein. All the things you do, they have to use that statistics to really to the see real properties of the other process. Now that's what they did. In fact, they used that statistic. That is only by statistical phenomena. So this is a statistical way that it is a statistical phenomena. The wave is so it's a probability where it is there. That is the Bose-Einstein condensate. Now they use a lot of mathematics. Yes. So BEC sensors now they're coming up. It's ultra sensors. They are so sensitive to the any changes, so they can deceiving. Artificial intelligence. Here, Dr. Mukherjee is talking about. Now the sensors can do individual atomic level in the cell. If there is a change in the behavior, any anomaly, that can catch it. The ultra sensors, the Bose-Einstein condensate sensors can catch. So that's a new kind of sensors, ultra sensitive sensors. These are all. BC can detect the minute disease changes in the diseases deep within the cell. One cell acting funny, it can amplify and gives you the results. So if it changes the AI, you can add AI to it, and then you amplify the signal. You can see this is still is in the research field. There's a lot of research going on in the Bose-Einstein condensate. They are the great sensors. That's a future potential of the Bose-Einstein condensate in medicine. So what is another property of the Bose-Einstein condensate is that it stops you can stop the light in the tracks, almost grinding halt. You can catch the light particles with your fist. Is that slows down? It's impossible. The Bose-Einstein condensate acts very strange material. It is also drips. If a Bose-Einstein condensate you put in the glass, it goes through a glass. So it has a very peculiar properties. So it is a very peculiar way of doing things. So that's why this is explained by Bob Shaw, a science fiction writer. He said that if you want to see a few past and future, sometimes we don't know whether we are seeing the past because there could be a Bose-Einstein condensate in between us, like a mirror that you see 10 years because the light goes so slow. We are getting the signals 10 years ago. If you take take the Bose-Einstein condensate, that mirror out, that glass out, that it becomes a present. So it's just a fictional story that Bose-Einstein condensate is using as a mirror. It gives you transforms in single minute, single second. It gives you from the past to the present 10 years or 20 years, 100 years, whatever it is. That is the power of the Bose-Einstein condensate because it changes its place with the light. So that is the Bose-Einstein condensate. One of the things is Bose-Einstein. Paul Dirac is one of the leading quantum physicists, and then he suggested a name for Higgs boson. God's particle. Now we are talking about CERN. They found out the bosonic field. We all in the bosonic field. We are living in the Bose, his name, literally in his name. Because we are going through trillions of bosons go through in our bodies right now. So we are in a bosonic field. The bosons are everywhere. So it gives a mass to the electrons, protons, all our electrons, all the protons. It gives a mass. Higgs field, it gives a mass. It's called a boson. The name suggested by Paul Dirac suggested the Sachendranath Bose name to name that that field, that particle, Higgs particle, as a boson. That's why it is called Bose. Is named after him. It is called boson. It is named after Sachendranath Bose. So I don't know what happened. I hope
I can still hear you.
yeah, I can hear me. Okay, good. It's something is acting up a little bit. Can you see my screen?
Yeah,
Okay.
sure can. Yeah,
Yeah.
sure can.
Yeah. So that is Higgs bosonic field. Then that he was. Then some people say no, BEC could be a soul. Soul is information content. When you die, probably soul could be escaping from us. The information process. A BEC could be. It's just a long way to think about it, but it's at least you can imagine BEC could be a soul. It is of information content. It preserves information. It can carry information. Bosonic
Hey,
BEC.
Romano, what was the name of the MIT professor that you showed earlier?
Daniel Kaplan. He won the Nobel Prize recently, actually.
What was his name?
Yeah, Daniel Kappelman.
Keppelman?
Yeah, Daniel. I'll send you that name to you.
Keppelman?
Daniel. Actually, he won the Nobel Prize. He was. They were expecting him to win the Nobel Prize. He did not win in the beginning. There's three professors from the University of Colorado, Denver, Eric Cornell, and the Catterall and Wolfgang. They won the. Actually, I have their information. I don't know. Oh yeah. So they know they won the Nobel Prize. Then after that, recently they awarded the Daniel Kupperman has the he won the Nobel Prize for the Bose-Einstein condensate. He really reproduced it again for the different atoms. So he won the Nobel Prize recently, actually last year, I think. So Bose-Einstein condensate won almost 10 Nobel Prizes in that field. It's a very integrating field. It's a BEC. I asked it at ChatGPT, is a BEC, Bose-Einstein condensate, could be a soul. That is a very interesting way I put together, he said. The AI was telling me that's a very interesting comparison, it said. So at least I got some validation there. So Sachendranath Bose, actually, that Heisenberg uncertainty principle I was talking with you, he was with Rabindranath Tagore. Rabindranath Tagore is a poet, but he loved science. So Dr. Mukherji is advisor to Santiniketan, is the founder of the Rabindranath Tagore's Institute. Dr. Mukherji is an advisor. Think about that. Rabindranath Tagore met Heisenberg, in fact. So he loved quantum physics. So Heisenberg, the Rabindranath Tagore was a very fan of science, in fact. Then Sachendranath Bose, they call him God's particle, father of the God's particle. They call him. He met Niels Bohr. He's a quantum physics, father of the quantum physics. The Sachendranath Bose he spent a lot of time with Niels Bohr, and then he was with Heisenberg, with the Albert Einstein. He met Albert Einstein. Eventually, he met Albert Einstein. He went to Marie Curie. He worked with a lot of famous scientists in Europe. I don't think he came to the United States, but he spent a lot of time in Europe. Sachendranath Bose. So he was a truly amazing figure, underrated. That's why a lot of people I want to bring him. His contributions are coming to the fruitful now. You never know until it happens what she will woe to the dead. That's what he said. That's really what we owe him. Thank you for listening. Let me bring back Dr. Suresh Mukherji back to the stage.
Oh,
So
yeah.
what do you think, Dr. Mukherji?
No, that was fabulous. Now, I remember last time we talked about something similar, but even on Sunday night, one of my really good friends is the former chair of physics at Indiana University. So we were actually talking about the Bose-Einstein condensate and the Bose-Einstein statistics. And then we were also, the last time I was with you, you taught me about the Bose
Symmetry.
No, the particle, the God particle.
God particle, the Higgs boson, yes.
Yeah, Higgs boson particle. You're exactly right. I think he's probably in a way, he's almost like Nikola Tesla. Nikola Tesla did so many things in the world of physics and electromagnetic and storage that people don't really understand his contributions. I mean, they understand Elon Musk and the name of the company. They don't really realize Tesla's contribution to our understanding of chemistry. Just like I don't think people really understand the contributions that Bose made to our understanding of physics. So I applaud you for bringing this to light, especially for someone like myself who's Bengali and has a relationship with the Santiniketan. But I'm a little bit embarrassed to actually be on the same platform as people like Bose and Tagore. Those are
This,
iconic
oh,
figures. So just for me to have my picture next to them is it's quite an honor.
yeah,
So
it is. You are no less, Dr. Mukherjee. You paid your fried juice. You are already a professor of radiology and radiation oncology, and you're doing a great job. So that all the hardware is coming in one side. The hardware is sensors. New sensors are coming. The AI side is new things coming. You think that you will see a lot more progress in the one of the things, for example, I wanted to ask you is, maybe it's outside of your field a little bit. A lot of times in the pregnant woman, they get a OB ultrasound. We do a lot of OB ultrasound, and then that problem is that is a very operator dependent. We have a technologist has to do right way, and then radiologist has to interpret if they're available in Africa and other countries, in India, in remote areas. They don't have all these technology. If you can come back with this probe, a phone based probe, if they can take the pictures and AI can, you think, it detect anomalies in the pregnancy, and really helpful to the entire humanity, you think, Dr.
yeah,
Mukherjee?
that's that's already available. I think what you're referring to is the ability to take a ultrasound probe and attach it to an iPhone, and then once the data is actually on the iPhone, then to be able to transmit it um, uh, without wirelessly to any tertiary or quaternary institution. So that capability is already present. I think part of the challenge has been to make sure that the resolution of the probes are actually sufficient. And then because there's so much data that's being acquired, there has to be some way to send it electronically to different institutions. But the capability is already there. And I remember about 10, 15 years ago, we were actually looking at these iPhone probes that can be plugged into your iPhone, that you can actually perform remote ultrasound. So it's there. It just needs to be further developed.
Yeah, I work with the company is not too far from here, Exo Imaging. It is 2 blocks from here. That is, they produce the iPhone based probes, actually. They manufacture. It's called Exo Imaging, EXO Imaging. They produce that probes. But they're coming up with, I think, yeah, as you're right. So you think we are going to progress, particularly, let me ask you about cancer. It is a really devastating, is becoming a big problem for humanity. Do you think we have any hope in this one to find a cure and cancer and stop this in progressions of the cancer? What is your opinion on that, as a doctor, a radiation oncologist? You can give some idea about that in general. It's nothing to do with the a philosophical question.
Oh no, I think absolutely 100%. When you say cancer, it's almost talking about world peace because there's so many aspects of it. But even in my lifetime, there's certain cancers that were present when I was born that if you had them 35, 40 years ago, they were death sentences. So for instance, if a child had a Wilms tumor, a tumor of the kidney, that was a death sentence for that child when I was in my teenage years. You just never wanted to see that. I still remember going to my doctor, and I would always worry because when they would palpate the base of my neck, they were looking for lymphoma. They were looking for Hodgkin's disease. And again, 40 years ago, when I was your age, um, there was no cure for Hodgkin's disease back in the 1980s. But if you look at just things like Wilms tumor, if you look at various forms of lymphoma. If you look at leukemia, even types of head and neck cancers, and certain brain cancers, there are cures for those that we could have only imagined. There's certain cancers we haven't made a lot of progress on, but I think one of the big advances that we're making right now is that historically we've made the diagnosis of cancers by looking at a slide. Well, now the World Health Organization every 5 or 6 years reclassifies tumors based on the latest science and the latest advancements in science. So now we're slowly going through a phase where the tumors are not necessarily diagnosed by what we see on a slide, but they're diagnosed on specific proteomic changes and genetic mutations. So where this will make a difference is that in general, if you had a tumor in your brain, that was always distinct from a tumor in the rest of your body. But what we're seeing now is that there are certain gene mutations that are similar for brain tumors and other parts of the organs. So previously untreatable tumors in the brain may in the future be able to be treated because they have the same genetic mutations as tumors in other parts of the body that actually may be successfully treated by certain regimens. So our better understanding of tumors, not as looking at a piece of tissue that's cut and colored and looking at a slide, we're now actually looking at the molecular basis of those disease. And when you look at the molecular basis of the disease, I mean, you've heard of things like 23andMe, and you've heard of all the ways that we can look at gene mutations and protein mutations. It's just a matter of time where we develop a technology that's going to allow us to better understand those. And then once we understand those better, then we'll be able to potentially develop cures based on the actual genetic mutations and the protein signatures of these tumors.
Dr. Mukherjee, I'm a physics major. I am a physicist. In physics, we have only one thing, only one really killing us. We want to make all the forces into one. Gravitational, electromagnetic force, and the strong and weak forces. There are 4 forces up there. We want to make it as a single force. That is our only one goal. Because we think the universe is born in one force and it came and became a different forces. We need to find out the holy grail of the forces. That is our never-ending goal for all the physicists. They non-stop looking for that. But I don't see that kind of a zeal among the doctors looking for that single holy grail of cancer. Where is that holy grail of cancer starting from? Because everything is cellular. Are they looking for that holy grail where that starting point for that cancer is?
Yeah, I think the answer to that is yes. I think you're looking at the actual pluripotential cell that we all arise from, and somehow that development from that singular entity that you're talking about as it develops into a human, somehow that mechanism goes awry. So the issue is right now we're looking at it as, I would look at it as a tree. So if you have a very large tree, you have the stalk of the tree, or the main, I'm blanking on it, but the trunk of the tree. Then you have the limbs of the tree, then you have the leaves of the tree. And what we've done so far, in the first, 40, 50 years ago, we were trying to cure cancer by looking at the leaves. Now what we're starting to do is that we're looking at the genetic basis of these and the proteins. So now we're actually trying to look at the different limbs. But the more and more understanding that we have, we've gone from the leaves, now we're going to the limbs. The more and more understanding we have, eventually we'll get to the trunk of the tree. And then eventually we want to get to the roots of the tree, of that tree. I would say right now we're getting from the limbs to the trunk of the tree, because there are many cancers that we can treat successfully based on specific types of proteins these tumors express. Just like we were talking earlier about pancreatic cancer, you can look at a specific molecular marker for pancreatic cancer and we can detect that now. We haven't been able to come up with a cure. What actually causes that cancer to become a cancer? Once we find that out, then we're going to get to the trunk of the tree. But that's really where all the research is going. We've gone from the leaves to the limbs. Now we're heading towards a trunk, and eventually we do want to get to the roots of all.
You're a truly great teacher. I can tell you, he explained very well. But let me ask you, are there any companies now in doing AI? Do you know any companies, AI in radiology? Are the companies active in AI in radiology field?
Well, as of, let me show you if I can show you that slide. And again, because this is the part of the talk that I'm giving.
Just you can mention
As
the
of,
name.
yeah, no, as of 4 months ago, there are about 300 companies
Oh,
that are
really?
really focused on radiology artificial intelligence, and that's just in the radiology space.
Oh,
And each company has different types of algorithms of software. So, for instance, there's one company that is an AI company that has an algorithm to look for brain hemorrhages, to look for emboli in the lungs, to look for breast lesions, so on and so forth. So you have certain companies that are developing algorithms just to look at, brain hemorrhage. But on the other hand, you have companies that actually have created 10 to 15 widgets to look for different abnormalities in the body. That's part of one company. So when you look at it all, it's probably about 700 or 800 individual softwares that are available for, and now we're just talking about disease detection. And I'm not even talking about the process improvements and how we can be more efficient at what we do. But when we talk about the high profile things, is to be able to detect breast cancer. If you have, a nodule in your lung, is it benign or is it malignant? If we have an AI algorithm that can take the information and say, well, that lung nodule is more benign than it is malignant, well, that patient probably doesn't have to have a thoracotomy and doesn't have to have that nodule removed. Similarly, a lot is in cardiac disease. If you're prone to have cardiac disease, the way that the gold standard is to perform a cardiac catheterization. Well, there are a lot of AI algorithms that can actually look at the heart, look at the perfusion of the heart, the blood supply to the heart. And if it looks okay, then that patient can avoid having a cardiac catheterization. So these types of companies, there are hundreds and hundreds of these approaches. So eventually we'll figure out which ones stick and which companies the product weren't good enough and which ones were good enough to really make a difference in patient care.
thank you, Dr. Mukherji. It's always an honor and a privilege for me to talk with you. You are the great friend of this podcast. You appeared several times. When I was not even popular at the time, you took a chance to appear. Now, thank you for support and thank you for the compliments of this my podcast. People like you really added so much flavor to this podcast. Thank you.
Thank you very much. And do send me the name of that physicist. I want to learn more about him. The one from MIT. So
Yeah, sure. I'll send you that one. Thank you, sir. So I hope you like my podcast. Keep watching it, and then I hope to give you more and more information about these new kind of things that I want to give it to. Thank you, sir. You're truly an honor for me to have you. You're a great guest.
thanks, Ramani. You have a great day.
Good night, all of you.
All right.
Telling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it